We're really delighted to be sharing our journey with you today on the development of the Trace Organisational Toolkit, and to showcase really how it can be applied and how it can be used within your organisations. There will be a question and answer session at the end of the presentation. So if I could just encourage you to pose any questions within the chat bar, I will do my very best to moderate them as we go through. Just in terms of housekeeping, really, if people can turn their cameras off and also stay on mute for the duration of the presentation, that would be great, because that would just help us with our connection issues. The other thing to mention is that we will be recording the presentation, and this will be made available afterwards for those people who haven't been able to join us. So with no further ado then, really, I'm really pleased to introduce my colleague Kelly McFadden, who's our training and skills lead, and Matthew Morgan, who's our higher education sector lead, and they will take you through becoming a Trace informed organisation. Over to you both.
Thanks, Vicky. Good afternoon and welcome to you all. My name's Kelly McFadden. My role in the ACE Support Hub is Training and Skills Development Lead. I've been responsible for working with the sector relationship leads within the Hub and also with key external professional groups, including universities and national training bodies, to facilitate the embedding of ACE skills and knowledge development relevant to each sector. So the webinar this afternoon will focus on the development and pilot of our Becoming a Trauma and ACE Informed Organisation Toolkit. So throughout the webinar, I will talk about what it means to be trauma and ACE informed and why it's important that all organisations consider this, why everyone has a role to play. I will provide an overview of the aims of the Support Hub, how we have delivered, the work we've delivered since we were established, and how this has informed the development of the Trace Toolkit. I'll give an overview of what's included in the toolkit, and I will then talk about how it's currently being piloted and evaluated. So to begin, let's recap on what ACEs are. Now, I know the majority of people know this, but I'm going to provide a bit of context. ACEs are traumatic experiences occurring during childhood that cause children to repeatedly suffer. They could be experiences that directly harm a child, such as abuse, or experiences that indirectly affect a child through the environment they live in. So, for example, growing up in a house with domestic violence. There is potential for these experiences to result in trauma that can continue to affect people as adults long after the trauma has happened. In 2015, Public Health Wales carried out the first national study into the prevalence and impact of ACEs in Wales. This study resulted in the publication of 3 reports. One report on ACEs and their association with health harming behaviours, another on ACEs and the association with mental well-being, and another report on ACEs and their association with chronic illness and health service use. A second study was carried out in 2017. Again, data was collected on the prevalence and impact of ACEs, but this study also considered resilience resources as protective factors in mitigating against the impact of ACEs. Now, we're not saying that all... Sorry, can I just ask whoever hasn't muted to mute? There's a bit of feedback on the line. So we're not saying that all ACEs cause trauma, but we do know that toxic stress can occur when there is repetitive, prolonged or cumulative exposure to adverse experiences at developmentally vulnerable times. We're also not saying that all trauma is caused by ACEs. A range of adversities may be present in people's lives. We all have vulnerability. A trauma and ACE-informed approach is one that can benefit everyone. Anyway, back to the research. In terms of the prevalence of ACEs in Wales, we know that at least half the people in Wales have an ACE, and 1 in 7 people in Wales has experienced 4 or more ACEs. The research tells us that in the absence of protective factors, such as the buffering support from a trusted adult, ACEs can increase a person's risk for chronic stress, and adverse coping mechanisms, and can potentially result in lifelong chronic illness. However, ACEs do not define us. Negative outcomes are not our destiny. The approach we are taking in the hub is a strengths-based one, not deficit-based. ACEs affect all of us. They're not just about children. They affect people of all ages and cross every social boundary. There is a close relationship between ACEs, so what happens within a family, and the context in which these happen. Living in adverse community environments will usually intensify the impact of ACEs on families and individuals. In addition, those living in adverse community environments may be less likely to have access to resilience resources. A good illustration of this is the Building Community Resilience Collaborative's Pair of ACEs tree. This image cleverly illustrates the relationship between adversity within a family and adversity within a community. The leaves on the tree represent the symptoms of ACEs. If the tree is planted in poor soil that is steeped in systemic inequities, robbing it of nutrients necessary to support a thriving community, this results in adverse community environments. These things can compound one another, creating a negative cycle of ever worsening soil that results in withering leaves on the tree. Some of you may have noticed the image and quote I used on the previous slide as being from Charlie Mackes's picture book, The Boy, the Mole, the Fox and the Horse. For those of you not familiar with this book, it is a collection of reflections and conversations between 4 characters with a clear message of empathy and self-care. Its popularity suggests the book has offered hope to hundreds of thousands of people throughout the COVID-19 pandemic. I know I have certainly found it soothing, and I have gifted it to several people I thought needed some comfort during difficult times. More snippets from the book will pop up throughout my slides, but the point I wanted to make was that the COVID-19 pandemic is an example of collective trauma, a trauma that is happening to everyone. That said, we need to recognise that we are all experiencing the pandemic differently. We might be in the same storm, but we are not all in the same boat. Individuals who are already vulnerable are disproportionately affected. The same is true for ACEs. We can do things differently. We can all play a role in preventing and tackling ACEs. ACEs do not define anyone. It's never too late to break the cycle of adversity. Kindness is the most powerful form of human therapy and can have a healing effect. Kindness and relationships are at the heart of trauma and ACE-informed practice. Being trace-informed is recognising that trauma experiences are a possibility for anyone we meet in our personal and professional lives. This isn't about more referrals or counting ACEs. It's about taking the time to understand what's happened to people, not blaming or stereotyping. And we don't need to know what happened, we just need to understand that people are shaped by their life experiences. Being trace-informed means a society and a workforce that's more compassionate to people. Sorry, can people press mute who haven't already done so? Thank you. Being trace-informed means a society and a workforce that's more compassionate to people. The people who use the service, the workforce providing the service. It's about offering 5 core principles: safety, choice, collaboration, empower and trust. And more about these principles later. But first I want to give you an overview of the ACE Support Hub, what we've been up to and how this has led to the development of the Trace Toolkit. The ACE Support Hub was established in March 2017 following the groundswell of interest in ACEs that resulted from Public Health Wales's national survey. The Hub is directly funded by Welsh Government to create an environment for large-scale whole system transformation. Our mission is to enable and support organisations and communities in making changes that make Wales a world leader in preventing, tackling and mitigating ACEs. We aim to challenge and transform ways of working and create a societal shift in order to break the long-term cycle of ACEs, adversity and trauma. One of our aims is to develop knowledge and skills amongst professionals. To support this, we developed the ACE Skills and Knowledge Framework to describe what is needed, what we need the workforce to know and be able to do. To inform the development of the framework, we established an advisory group, and we looked at NHS Scotland's Transforming Psychological Trauma Framework, as well as a number of relevant frameworks in Wales, such as the National Safeguarding Framework. We held a series of multi-agency consultation events, which led to us being able to describe the knowledge and skills across 3 workforce groupings. The first of these workforce groups is ACE informed. ACE informed people understand what ACEs are and understand their impact throughout the life course. Ultimately, ACE informed people have universal knowledge and skills which underpins everything else. We felt that this category was relevant for all workers with direct contact with people who may have experienced ACEs. And by people, we mean colleagues, we mean service users, clients, patients, members of the public. We mean everyone. The next grouping is ACE skilled. We felt this category best described frontline workers, those with regular contact with people. The framework details the comprehensive knowledge and applied skills this group of the workforce needs to be able to critically appraise issues and support people who may have experienced ACEs. The third group is ACE influencers, people with a strategic leadership role. They should be ACE informed. They should enable others to become ACE informed and ACE skilled, and they should ensure appropriate workforce support is available and accessed. They should ensure an ACE-informed approach to managing services and teams. And most importantly, they set the culture which acknowledges ACEs as a public service issue requiring a quality response. In order to develop knowledge and skills amongst professionals, we have worked with key sectors to co-produce training solutions relevant to them. This includes training for schools, youth work, housing and sport, and more recently, further education, preschool settings, asylum seeking and refugee sector, and substance misuse. We have also worked with some areas of health, for example, health visiting, school nursing, and speech, language and communication. We also explored generic multi-agency training and have developed an introduction to ACEs e-learning package, which is available on Learning at Wales, as well as for NHS staff on the NHS Wales electronic staff record site. More information about the specific training solutions can be found on our website, detailed in the training prospectus. However, I need to point out that the Hub isn't set up as a training provider. We have worked with sectors to co-produce training, to facilitate ownership of materials and to build sustainable methods of training delivery. So I've just given you a flavour of what we've done to develop knowledge and skills amongst professionals in key sectors. The rationale for developing the toolkit came from our learning from working with these sectors and the independent evaluations of this work, and also a baseline survey of ACEs knowledge and skills in Wales. As we developed our understanding about what sectors and organisations need to enable them to grow their internal and external networks to change practice, we also needed to consider where the gaps were and explore opportunities for creating the carrot to dangle to engage sectors we had not yet worked with. In addition, we recognise that training alone will not lead to transformational change. ACE awareness without changing your practice is just something you know. We need to do something with what we have learnt. We need to change something, no matter how subtle, to achieve any improvement. Often the problem is that knowing something does not mean that the doing changes. Learning and then doing is far more important than learning and just knowing. learning transfer, embedding trace-informed practice, an organisational approach, and a whole systems approach is needed. So we wanted to create a resource that would help organisations embed the learning. We wanted to create a resource that helps organisations to reflect on how they establish a culture of safety, of trust, collaboration, choice and empowerment, with all members of the workforce playing a part. In addition, we also recognise that for some professions this is nothing new. The phrase old wine in different bottles being mentioned a lot. People telling us, we know about ACEs, we're already working in a trauma-informed way. So we wanted to create a toolkit that would resonate with these professionals and help them think about what they could do differently, how they could do better to improve outcomes for people. This quote from Michael Marmot, taken in the context of addressing health inequalities, fits perfectly here. If you're doing nothing, do something. If you're doing a little, do more. And if you're doing a lot, do better. There is always more we can do. We can always do better. There is always room for improvement. This was the ethos on which the Trace Toolkit was designed. Essentially, the toolkit aims were to bring together everything that organisations might need in order to develop their organisation and to ensure that kindness and compassion is at the heart of what we do in Wales in transforming public services. To develop the toolkit, we undertook desk research to understand the evidence base and to explore what frameworks existed. Examples of existing toolkits we looked at include the Substance Misuse and Mental Health Service Administration's Concept of Trauma and Guidance for a Trauma-Informed Approach, and also Stephanie Covington's Becoming Trauma-Informed Toolkit for Criminal Justice Professionals. Building on our learning from working with key sectors, the work I described earlier, we drew on basic change management and improvement methodology to develop an approach that would hopefully resonate across a range of different organisations across different sectors. We then set out to pilot and evaluate using a realist evaluation approach. So that was the approach we've taken. And now a bit about the toolkit itself. So the toolkit is built on the principles of trauma-informed care. So let's take a look at what these are. As I said earlier, being trace-informed means recognising that trauma experiences are a possibility for anyone. It's about incorporating knowledge of ACEs and trauma into everything we do and taking into account that we are all shaped by our life experiences. The first principle is safety. This is about ensuring situations and environments where people feel emotionally, physically, spiritually and culturally safe. It's an important step to building trusted relationships. The next principle is choice. This means maximising opportunities that offer choice and control in order to promote healing and avoid re-traumatisation. Next, we have collaboration. So this is about maximising collaboration and the sharing of power through providing an inclusive approach and creating opportunities for shared decision making and for ongoing feedback. Empower is about maximising opportunities which build on and validate others' strengths and creates opportunities for individuals to take power for themselves and realise their individual strengths. By using a strengths-based approach, we recognise and build on people's strengths, abilities and resilience levels. And finally, we have trust. This is about maximising trustworthiness through relationships, task clarity, consistency and interpersonal boundaries. So the toolkit offers a process to support change and implementation. The process involves 4 steps. Step 1 is preparation. There must be organisational-wide sign-up to completing the self-assessment process and a commitment to reflect on and action any improvement activity needed. The organisation should be clear about the purpose of the exercise before they complete the self-assessment tool. So what we suggest is that before the self-assessment tool is completed, the organisation needs to understand how it fits with their overall strategy. Step 2 is completion of the baseline assessment tool. This stage is about exploring the 6 domains and how each maximise the opportunities for safety, choice, collaboration, empowerment and trust. The domains are governance, leadership and organisational culture, policies and procedures, workforce support and training, the physical environment and service design and delivery, and then finally monitoring and evaluation. The self-assessment process aims to be a reflective process which can highlight existing good practice and identify areas where improvement could be made. A golden thread throughout this should be the involvement and engagement of everyone who experiences the organisation. Step 3 is about action planning and implementation. So this involves taking the improvement areas which have been identified in the earlier stage and working them up into an action plan or an improvement plan, and then putting this into action. Step 4 is monitoring, evaluation and review. The idea is that this is an ongoing journey of improvement with further activity identified at step 4, feeding back into the action plan or improvement plan. As I mentioned before, a golden thread running throughout the steps and domains must be collaboration, engagement and involvement of stakeholders, both external and internal, the people who experience our organisation or institute, including our staff. Now at this point, I'd like to share a bit of a personal reflection because throughout the development of the toolkit, I felt conflicted by creating this process because we talk a lot about the approach that's needed is one that's relational, one that puts people and relationships before process, and yet here we have a process. In addition to this, I didn't want this just to be seen as a tick box exercise completed just once, but more of an ongoing commitment to embed empathy, kindness and compassion to maximise opportunities for safety, trust, collaboration, choice and empowerment, to commit to ongoing monitoring and evaluating, recognising that we can always do more, recognising that this is about striving for continual improvement. What we've created, therefore, is a process whereby organisations can pledge or declare their commitment to being Trace informed, and that this is a commitment that will be reviewed on an annual basis. I'm now going to give you a bit more information in relation to the domains considered in the self-assessment form. The first domain is governance, leadership and organisational culture. This domain relates to the overall support for and investment in implementing and sustaining a trauma-informed approach. Examples of things to consider here are that directors, leaders and managers understand ACEs, trauma and adversity, and that there's an organisational statement of commitment to growth and change towards becoming more Trace informed, and that this is communicated and understood across the organisation. I've used this image on the slide because there needs to be brave leadership, honesty about what we currently do. How we are measured often means hitting the target but missing the point. There needs to be a commitment to reflecting on what might need to be done differently and to take action. The next domain is about policies and procedures. This relates to how organisational policies and procedures demonstrate commitment to and enable internal systems to reflect the foundational values and principles of trauma-informed practice. So, for example, how do policies and procedures recognise that trauma and adversity are possibilities for everyone? How do policies and procedures consider the risk of re-traumatisation and the promotion of opportunities for well-being, for healing, for recovery? Do our policies and procedures reflect the values of kindness and compassion and the importance of relationships and connections? Does kindness sit quietly beyond all things? The next domain is about workforce training and support. This domain refers to ensuring knowledge and skills within the workforce, enabling trauma-informed principles to be embedded in an ongoing supportive learning cycle that recognises the importance of the well-being and the physical, emotional, spiritual and psychological safety of the workforce. So, for example, is reflective practice endorsed to include the impact on own well-being, self-care and safety? Is there access to communities of practice, action learning sets or similar opportunities for sharing of knowledge and skills in relation to trauma-informed practice? Do staff feel safe to express feelings, to make mistakes and reflect on their own and others' thoughts, emotions and behaviour? Being Trace informed is as much about the workforce as it is about those who access our services. It's about everyone who experiences our organisations. The next domain is physical environment. This relates to how physical and social environments promote safety. Things to consider might be, how do physical and social environments promote a sense of physical and emotional safety for all people experiencing the setting? Do we consider how aspects of the physical environment might be re-traumatising? Do we provide spaces that promote health and well-being, spaces for people to use to practice self-care? With service design and delivery, this domain relates to ensuring that trauma-informed principles are incorporated in all aspects of service delivery. This domain includes reflecting on whether services are designed with an understanding of the prevalence and potential impact of ACEs, trauma and adversity. Are services organised in ways that recognise that something has happened to the person rather than it's being about what's wrong with the person? How responsive are we? How do we consult and engage our service users and staff? Are services created to maximise opportunities for safety, trust, choice, collaboration and empowerment? Do services recognise the importance of relationships? And how do we consider us as part of the whole system, the whole customer journey, thinking about the interface with other services, both internal to the organisation and across partner agencies, to ensure that there is a mutual understanding of trauma-informed practice? The last domain is about how organisations monitor and review progress of their Trace journey. It's about consolidating what they've done and building on it. Again, it's about how they involve and engage everyone who experience the organisation. Again, it's about recognising that no organisation is an island. There are always interfaces with other organisations. So, how effective is cross-organisation, cross-sector collaboration? How can more of a systems approach be taken? How can we do better? And it's about identifying what improvement activity is needed next. So that's an overview of the toolkit. It was launched in July 2020 and we published a call to action for organisations to pilot the approach. We're also using it to inform sector-specific approaches, for example, how we create the blueprint for trace-informed further education and trace-informed higher education in Wales. And where we are now is that we are taking learning from a range of organisations who are piloting it. So before we hear from some of those organisations, I'm going to invite my colleague, Matthew Morgan, to talk about our work with further education, our work to co-produce the Trace FE offer and how the toolkit has featured in this work.
Thank you, Ellie. Hi everyone. My name's Matthew. I'm the sector lead with further education. Been in post since August 2020, and during that time I've been engaging across the FE sector to establish a collaborative working relationships to ensure that all FE colleges become trauma and ACE aware. The engagement has and will continue to shape the bespoke package of training resources that will inform the training offer. So we've created working groups, and the engagement really has been exceptional from the collaboration across the sector, and we've been able to set up the groups. We brought together an expert reference panel that became a sector steering group, and we'll continue to assist the process from a strategic perspective. We've also set up a community of practice that assists with influencing of the whole college approach within their institutions. And further from that, now we're looking to secure two trailblazing colleges that will help to pilot the resources that we've created. The resources are going to be held on the Welsh Government Hub, and they will be for all institutions to access, and will hopefully enhance the opportunity of making the project's aims and objectives a more sustainable process. It is our aim that the expert reference panel, as well as the community of practice groups, will then become self-governing to continue the amazing work after that's been started, so after the kind of project has come and gone. So we spoke about the co-production. Since the groups have been brought together, I've worked alongside them to co-produce a bespoke training package for the FE sector. The co-production began with the ACE support of delivering selected sections of existing resources that highlighted the work that can benefit their institutions. And from that, the expert reference panel were able to inform the process of how the bespoke package could be produced. The process has now been broken into two phases, with phase one exploring the background into trauma and ACEs and its impact on the brain development and physical and emotional well-being. The phase two looks deeper into the common language and methods of managing situations that can stem from someone who may be ACE experienced or have been affected by them. Both of these phases went through a critical friend session so that the work could be evaluated before its completion. What we've also done is we've accessed case studies that we're going to use to film to highlight the positive results for students that can be had by using this trauma-informed and ACE-aware approach. What we've done is we've secured some Coleg Cigar performing arts students that are going to have the films done over the next month and will be added to the list of resources that we've got. And then obviously to complement the training resources available, Hub has designed an assessment toolkit, as Kelly's been speaking about, that allows the colleges to assess what is currently being done, as well as looking at opportunities that are available for improving their support provisions. We're very grateful to College Cambria and Pembrokeshire College, who have both proven influential for the work and have taken the time to pilot the toolkit for us, which I think has been proven to be a useful exercise for both colleges. But rather than taking my word from it, what we're going to do is we're going to take a look at the short clip by Maxine Thomas, who is Pembrokeshire College's designated senior lead for safeguarding and wellbeing. It kind of gives a little bit of an insight into how the Trace Toolkit was for them and kind of how it's hopefully going to shape their and improve their resources. And thank you.
Good morning. It's my pleasure this morning to just feedback from Pembrokeshire College on the implementation of the ACEs and Trauma-Informed Toolkit. As a college, we have been very privileged to be alongside College Cambria in being the pilot college for looking at the toolkit and to feeding back to the sector. The toolkit has been absolutely instrumental for us in enabling us to look across the institution, to evaluate against our own practice, from governance and leadership, right across all of the delivery of our learner support services. The toolkit enabled us to not only identify actions that needed to be put in place, but also to monitor and review. It does, I believe, provide a framework that can be embedded across all of our safeguarding practice, across our inclusion work, and across all our transition arrangements. Never has there been a time when ACEs and trauma-informed practice has been so important in the sector. And going forward into the next year, I do believe that the toolkit will enable all of us, linked to our health and wellbeing strategies, to drive this very important work forward.
Thank you, Matthew. So we heard there from Maxine Thomas, the designated senior lead for safeguarding and learner wellbeing at Pembrokeshire College. I also wanted to mention that Lizzie Stevens, who is the inclusion manager at Cambria College, has been using the toolkit as a health check initially to identify areas for improvement. As Cambria College, they have engaged senior managers and have developed a continual improvement plan. They say the toolkit has helped to identify gaps in provision and gaps in training. One of the most important being the buy-in from senior management. Training should be focused on governors and leaders too, and this is where the sector offer is to focus on next. So we're now going to hear from two housing sector organisations. Firstly, we have a video clip from Claire Budden from Clwyd Allen.
Hi, I'm Claire Budden and I work for Clwyd Allen Housing Association in North Wales, and we've been using the Public Health Wales Trace Toolkit to embed our Trace way of working at Clwyd Allen. I'm going to talk to you a little bit about our journey and how we use the toolkit. So we've got an organisational mission to address poverty, and we've got 3 simple values that inform the way we behave with each other at work and the way we work with our residents, and they're trust, kindness and hope. For our residents, what that means is we offer person-centred services. We're working towards not evicting any of our tenants, and we've got a really fresh approach around what's commonly called antisocial behaviour. So again, our approach here is to work really positively with our tenants, recognising that where people cause problems to neighbours, that's normally because of some other issues that they're having to deal with, whether that's an addiction, whether that's a mental health issue, physical health issue, or some other challenge. And our approach is to proactively work with people, building trust, providing them with the support that they want to enable them to live successfully in our tenancies. And this work over the last few years has seen our evictions reduced by 85% in the first year. This year we've evicted nobody, and we're confident now that we're on a journey of having much stronger and more positive relationships with all of our tenants and residents. For our staff, this also means adopting a person-centred approach, and we're working towards having no disciplinaries, no conduct cases, no grievances and no capability cases, recognising that if we recruit people with our values in the first place, most people come to work intending to do a good job, and what we should be doing is providing the right kind of support to enable people to thrive in our organisation. We pride ourselves on employing a lot of people with lived experience of the services we deliver. So we have a lot of people who've been homeless working in our homeless services, for example. And we know that colleagues also sometimes need help and support to enable them to be able to come into work and give of their best every single day. So we've been using the Trace Toolkit to help us structure how we embed this way of working at Clwyd Allen. And we're also looking to learn from other people. So there's another housing association in Wales who's on the same journey, and there's a couple of education organisations. So what we're hoping to be able to do is to offer peer-to-peer support to each other as we work together on this journey. So we don't think we've cracked it totally yet. We are 18 months to 2 years in, but we are really starting to see the impacts of this approach, and we welcome the opportunity to use the toolkit. Thanks.
If you want to hear more about Trace and what this means for Clwyd Allen, please listen to our Kind Talk podcast. Our comms lead Sarah will share the details in the chat. It's a really inspirational podcast, and it gives a flavour for how Clwyd Allen are living and breathing the principles of trauma-informed care. Next, we will hear from Jason Smith from Family Housing Association.
Hi everyone, I'm Jason. I'm the Head of Care and Support for Family Housing, which is a housing association in South and West Wales, which, alongside providing housing and property services, also provides HSG-funded short and long-term mental health supported living as well as tenancy-related support services and domiciliary care services. As a leadership team in 2019, we committed to embedding the PI principles and approaches across the association as part of our new business plan. As you know, wrapped up within these principles is how we work in a trauma and ACE-informed way. We did this because we recognised that to make a real difference, we needed to ensure that there was this organisational-wide sign-up to this cultural change, because we could see the positive impact that it would have on the people that we support, not only in our care and support services, but all of our tenants and our staff teams. Personally, I think this was a really ambitious move for a housing association, and thinking about this across all the different types of services we provide, from people living in 24-hour supported living through to how we support people affected by and causing ASB, as well as people whose homes need repairing or are inquiring about living in one of our homes. But we also knew that we had to think about how we worked with people who weren't just using our services, but also the people providing them as well, how we supported our staff. So key to the involvement was going to be departments like HR, training and finance, who have to all be involved in this big cultural shift. And you know, when we talk of cultural shift and working in a trace-informed way, what it comes down to is, what we're really thinking through is how hope, trust and kindness are the bedrocks of the organisation, and how we respond in an informed way across all our services and in the support that we provide for our staff teams. So with that background, in October last year, I contacted the ACES Hub when I came across their Trace Toolkit. And this seemed like a really useful solution to kind of providing that framework of how we could look through all of these areas across our organisation and bringing together all of the learning that had already happened in some parts of our organisation to different extents. One of the key initial thinking points that we took from the toolkit and our ongoing journey to become a Trace organisation is really thinking about each of our staff roles within the organisation and aligning them to the 3 different categories for their ongoing development of their knowledge and skills. So what we started to do was think through as an organisation what types of roles fitted into those 3 categories of staff, being ACE-informed, ACE-skilled or ACE influencers. And that was a really valuable process and has provided us a clearer direction on how we are going to support each of those different roles moving forward into the future. And I think generally what the self-assessment process has done is developed our thinking about what we need to look at. And all of this has been a really exciting journey for us, and it just kind of keeps evolving and changing. And I think one of the benefits of taking this approach is that the trust that we have now in the organisation, that we're all sort of headed in the right direction, but we also know that we always won't get it right first time. So what this means in practice is that we might try something or develop a way of doing something and then come back and revisit a few months later with things that we've learned and then just change how we do it. So a good example of this is how we developed our 360-degree psychological model, and how we developed this initially based on the people we support and the feedback from the frontline staff that were supporting them, and then how we continually test and try new things within this model and new ways of working, and then we would go back and just update the policies and procedures that run alongside this all the time to reflect those developments. Whereas before we were sort of constrained by that annual or biannual review cycle of policies and procedures, but now what this has done is made that whole model just feel much more alive and much more responsive. So one of the areas that the toolkit considers near the end is how we can promote cross-sector collaboration. So we were really happy when ACES Hub, alongside New Systems Alliance through their Representatives in Wales platform, when they approached us about working together with them using the Trace framework and the Wisdoms methodology. So what we're currently doing at the moment is working with them to have a 3-month deep listening exercise across all of the organisation, all different departments, about the experience of trauma-informed approaches that service users, tenants, staff, senior leadership have, with the intention of providing then a launch pad for further change and the potential for future work. And the methodology is based on deep listening, which with a series of qualitative interviews with people throughout the whole system. And these will bring out that kind of rich information about people's experiences and the barriers and re-traumatizing challenges within the system that we can then use alongside Trace to further develop what we do across the whole organisation. And all of this fits really well with the work that we're doing with the ACES Hub and the Trace Toolkit, because it brings this rich information of people using and working in the system, the systems that we create, and really focuses on the relationship element of PI, which then allows us to bring together both the feelings and the emotions of people with the policies and procedures designed to support them. So we end up with this really clear picture, firstly of us as an organisation, and then where we can head in the future and the pathway that we need to develop into. So that is all from me, but if you've got any questions or would like any more information, then please do get into contact.
So a really interesting approach there from Family Housing Association. They've completed the self-assessment and they're now using an externally facilitated deep listening exercise to engage with and learn from people who experience their organisation and to inform their next steps for Trace. So where we are now, we're at the stage of capturing feedback on the toolkit and how it's being used. We have received positive feedback about the acceptability of the toolkit in terms of its structure, presentation, content and language. We have some insight into the key drivers and enablers that have contributed to progress. For example, having the right people within a task and finish group and the need to ensure that this agenda is communicated to all staff and that it's not just about benefits to clients or service users. Even in the early days of the pilot, some changes have been realised. For example, one pilot told us staff that are involved are thinking about the toolkit in relation to other elements of the service or at other meetings. It is more at the forefront of our minds than maybe it was previously. All pilots fed back that they had identified changes that they intended to make. One theme identified is around how messages can be filtered across staff groups at all levels, and how can consideration of staff needs in relation to trauma as well as clients and service users, how is that demonstrated? How training can be delivered and implemented, and how we can take forward ideas to support our staff. For example, staff timeout room, regular mindfulness practice. There were just some examples that came out. There is also an overall buy-in that this is an ongoing, continuous process, not a one-off exercise. We recognise that it's a small handful of organisations and it's early days for them in terms of using the toolkit, but the findings are positive and we will continue to evaluate the resource, taking a realist evaluation approach as a lens to understand what works for whom and in what context. So I hope this has been a helpful overview of the Trace Toolkit and how it can support an organisation's journey to becoming Trace informed. The more organisations there are on this journey, the more organisations that are using this approach, the more organisations embed the principles of trauma-informed practice, it will mean the more safe spaces there are for people. There will be greater opportunities for positive relationships and human connections. There will be greater opportunities for promoting well-being and resilience. There will be more kindness and compassion. I hope I have stimulated interest in not just in the comforting work of Charlie Mackesy, but also in the Trace Toolkit as a framework, as a process for generating improvement and sustaining change. We should never underestimate the big importance of small things. We can all make a difference. Thank you. Diolch yn fawr.
Thank you, Kelly. Thank you, Matthew. A huge thank you really to both of you, but also to the contributors. And I think, you know, what you've done is quite a really challenging exercise really in terms of bringing the toolkit to life. And it is challenging to bring kind of a process to life. And I really loved the way that you made it so real and relevant. And I loved the Charlie Maxey visuals, because I think those are quotes that we can just live our lives by. They're really relatable and really powerful. And I guess what you've presented really conveys a need for us to all be brave and put people, both our staff, our customers, our users of our services, at the heart of what we do. And what you've set out really is kind of the context of ACEs and trauma and their prevalence, why this is so important, why taking this approach is so important, and actually how we do that with the toolkit, how we apply that, but also how this is being used already, and how this is real and real life examples around it, and how organisations have already embarked on the journey. So it is a tool that's been developed with wide consultation. We know that, and it's kind of come from a Welsh context. We know it's not the only show in town, but we really hope that it's a tool that can be used by the people listening today, and something that will be really developmental and dynamic. There have been some questions posed. I've got somebody else to introduce to you to join Kelly and Matthew in answering some of those questions. So if I could ask Jo Hopkins, our ACE Hub Director, to turn her camera on now. She's going to join both Kelly and Matthew in answering some of those questions. Jo, over to you, just to give you an opportunity to comment, really.
Thanks, Vicky, and good afternoon, everyone. I'm sure you'll join me in thanking Kelly, Matthew and Vicky for taking us through what's nearly been an hour of really showcasing, I think, some of our work in Wales. I think it's been a really impressive presentation, but also I hope you enjoyed hearing some of the experiences of our partners in working with this, because it's great for us to be able to say, look at what we've done, but I think the value is really around hearing about what organisations feel about what they are doing and how it's changing things for not only for the people they work with, but also for their staff and their organisational cultures and ethos as well. So great, thank you all very much, and very happy to take any questions that can be lobbed at me, Vicky.
No problem. So we've had some questions posed in the chat. I think the first one was from Keris, and thank you, Keris, for putting this forward. Just really asking about, are we able to reflect on how the Trace Toolkit really compares and contrasts with similar approaches? So, for example, the Enabling Environment certification overseen by the Royal College of Psychologists, I think that is, isn't it? And as we understand it, I think that's about kind of creating an environment where people want to work, live and study, a really kind of nurturing environment, if I'm right. And Kelly, if I can just go to you, how does our work really overlay with that? Because in my mind, it's really complementary, isn't it?
Yeah, I think from from the similar approaches, the similar frameworks and toolkits that are out there, and there's some fantastic resources out there. What we tried to do was create something that absolutely complemented other approaches, but we really kind of wanted to create something that was, that resonated across a range of different sectors and organisations, that was very generic, I guess, in its style, but that could also complement, if they were, using one of those other approaches, that this could complement it. It's not necessarily about doing more, is it? But just using this as a lens to reflect on what it is that we're doing and what outcomes we're trying to achieve for the people that we're providing services for and for our workforce.
Thanks, Kelly. That's really helpful. And just moving on to a next question here, Sally Rees has posed, can you explain in a bit more detail how you will apply the realist approaches in the context of Trace? So I guess that takes us really to the evaluation stuff, Kelly, doesn't it? And the realist approach that we're taking in terms of the evaluation around the toolkit. Can you provide a little bit more detail around that?
Yeah, sure. The ACE Hub's evaluation framework has been throughout the years based on realist evaluation methodology. So this is based on the assumption that projects and programmes work under certain conditions and are influenced by the way that different stakeholders respond to them. Realist evaluation attempts to answer questions such as, what works for whom, in what circumstances, and learn about why that's the case. So they're designed to improve understanding about how development interventions work in different contexts. So, you know, we really wedded to this approach. You know, I'm not an evaluation expert, but I think, you know, this is an approach that we need to take to better understand the role of the toolkit and its effectiveness moving forward.
1 minute.
Can I add to that, Vicky, as well, in terms of...
Just going to say, Jo, can I come to you as well, just to talk a little bit more about the evaluation?
Yeah, sure. So I think, as Kelly has described, you know, the Realist approach is what we have done as a hub over the last few years. But we've also done specific pieces of evaluation around areas that have required perhaps a different approach to test that. So, for example, the further education work that Matthew's been leading will have a specific evaluation that looks at how this is being implemented in terms of both the resources developed and in terms of how it is, you know, being carried out within the sector. So that will inform then an approach that can be taken across a wider lens. So we, you know, spoke about the colleges that have come forward now, but will inform a sectoral approach. So it's a mix and match, I think, it's fair to say. So the overall ethos is the Realist approach, but within that we can look at specific areas that we want to be more focused on. And if you look at our website, there are a number of different pieces of evaluation that looks at, you know, how we've taken forward training and practice in certain areas. So I think overall, we'll get to a point where we have enough people and organisations involved in piloting that we need to kind of come together and say, what does this all mean? What does this all tell us? So the important bit for me at the moment is to collect the right data, to collect the right information, and as Jason was saying as well, bring together some of the different elements that certain organisations are looking at and perhaps evaluating themselves separately, so that we have that more holistic understanding of what this actually is delivering and the impact it's having.
That's great, Jo, thank you. And I think you're so right, isn't it, about kind of overlaying that information. Another question's been posed here in the chat from Faith, just regarding the project that she's working within, is working with children aged 5 to 16, and has there been any specific work with the age group and the toolkit? So I suppose, Jo, if I could just come to you for some kind of reflections around the education work that we've taken forward, and I guess how that then fits and interfaces with the toolkit work, because obviously the toolkit's really been developed on a lot of the sector specific stuff that we've done as a hub.
Yeah, sure. And I'll wrap in as well the question from Tim Opie, if I may, who was asking about how does this fit with the whole school approach. Thanks, Tim, for that. So in terms of the toolkit itself and the piloting here, you'll notice that these organisations are very much kind of in the adult space. I think, you know, that would be really great to work with an organisation that is looking at children of that age group. And I'm sure, you know, if people are interested or have organisations that they work with that you think that would be interested in that, then please do get in touch. And I think, you know, the starting point for this is here is a toolkit that helps organisations to think about their own journey. What we also do as a hub is think about, you know, in terms of sectoral approaches, what can we do to support the wider Welsh Government priorities as set out in the programme for government, of which obviously included the whole school approach for mental health and wellbeing. So as we went back to the kind of question around how does this fit with other frameworks, what I am absolutely clear on is this is not in competition with or trying to kind of rub up against any of the other frameworks and priorities that are being developed. We have been fully involved in the discussions around the whole school approach, and really pleased to see, and hopefully when it's launched you will also see that the work of the ACE Hub is mentioned in there as providing really a foundation in terms of the training that Sian Griffiths from the Hub has delivered across primary and secondary schools in Wales. But you know, that's an offer that has enabled us to get so far, and what we're looking at is continuing to build and develop further into that structural integrated systems change that we're talking about. So that, I think, is the key here. We've worked with sectors in housing, with Charlotte Waite, with youth service, with Laura Tranter, with, you know, Matthew's working in FE, and Vicky, you've been doing a lot of work with higher education as well. the key for this is to pull it all together. And I think what we're finding is that we can support and provide information that helps to further develop things like the Together for Children and Young People approach, the wonderful work that Liz Gregory's been leading in developing that framework for looking at the missing middle. You know, this is all interconnected, isn't it? So what we're trying to do is to suggest that this is another piece of the jigsaw. Let's bring it all together, and hopefully that, you know, as I'm involved in many of these strategic conversations and where I'm not, I should be, let's make sure that we bring it all together in a way that comes to that common ambition of making Wales certainly a more trauma-informed nation.
Thanks, Jo. I think that's probably a good place to leave it. I can see lots and lots of interest and lots of positive feedback within the chat. Jill, I would love to talk to you about working with the Health Board. Really happy to do that. Keris, Female Offenders and Youth Justice Blueprints, absolutely. All of our contact details are here on the screen, and resources available on our website. Thank you so much for kind of joining us today. It's been a really, really good opportunity for us to share our work with you. Somebody's exited already. So on that note, thank you very, very much. It's been a pleasure to spend some time presenting this to you, and we look forward to future work. Thank you very much, everybody.
Thank you very much.
Thanks, everyone.
Thank you.
Thank you.